health insurance because it's a huge issue right now. This is a time of year where you have to decide which insurance you want for the following year. You have to sign up your dependents, but there's a lot at play right now where the costs may be rising. In fact, I was doing a lot of research in preparation. You may see healthcare costs go up next year, especially if Congress doesn't extend those tax credits. Now, you're hearing a lot about rising premiums and who gets hit the hardest. Well, we have a guest here, Nathan Gusdorf, and he's here to help us make sense of it. He's the executive director of Fiscal Policy Institute right here in New York. So, Nathan, thank you for joining us. Can you talk to us about what's driving the sharp increase in healthcare premiums?
Hey, happy to be here. This year we're seeing healthcare premiums rise pretty sharply, but unfortunately that's not just something that we're seeing this year. It's really become the norm. And it speaks to what is the deep trend now in American health policy, which is that there are a few interests and actors that really drive up the prices. Chief among them, frankly, hospitals, drug manufacturers, and also companies like medical device manufacturers. But they have been pushing up healthcare prices for years, and health insurance companies, which in principle are supposed to keep down those costs, have really failed to do that job. And so instead what you see are rising premiums every year.
So how much more could families pay if these tax credits expire? What are we talking about?
So we have to do a little bit of distinguishing of the different kind of components of the health insurance system here. The health insurance companies themselves will drive up the costs of really plans across the board. Then separately, we have to go back to the whole landscape of Obamacare, because before Obamacare was passed, tens of millions of Americans simply didn't have health insurance because they couldn't afford it. So we created a national system of a basically subsidized marketplace where the government provides, through the mechanism of tax credits, cheaper health insurance that low and middle income Americans can actually afford. What we are now about to see, if Congress doesn't do a deal to extend some of those tax credits to keep health insurance affordable, is that for a sort of low middle income family, say earning around $75,000 a year, what they pay annually in subsidized health insurance costs could double from about $5,000 to $10,000.
Wait a minute. That's huge. From $5,000 to $10,000 divided across 12 months. That's a huge chunk of money for a family earning about $75,000 to stomach. Can you just put that into perspective? And forgive me for interrupting you, but when you said that number, that's huge.
It's huge. It's huge. I mean, again, this is one of the weird things about health policy, specifically in the US, where we do not have a national system that holds down these costs. It's always been understood to be an issue, I mean, going back to the 80s and 90s, but the prices have gotten so high that insurance went from being something that was in principle rising too quickly to something that people truly now cannot afford. And so if those subsidies go away, many middle-income families quite literally won't be able to afford health insurance.
Now, are we talking about families who get subsidies but also who have employer-sponsored plans? Is there a distinction between the two?
There is a distinction. So many people, you basically have health insurance provided through your business, and that is a different kind of subsidy. There is a tax benefit for it, but that's not the subsidy that we're talking about. For many Americans who don't get insurance through their employer, they buy it on the Obamacare market. And in order for that market to be affordable, the government directly subsidizes their purchase. So the tax credits that everybody's talking about that are up for debate in Congress are government federal tax credits that defray the cost of those individual marketplace plans that you could just go online and buy yourself without having to get through your business.
Your organization looks at this very, very, very closely. Are you predicting that people will just go without insurance, go in debt to cover it? What direction are we going to be going in?
Yeah, that's a great question, because it speaks to the way in which there are a number of different directions, and they're all kind of bad, but here's what will happen. Nobody really knows the proportions in which it'll happen, but there are some people, especially younger, healthy people, who just won't buy insurance because you can't afford it anyway. You think you're going to be okay, maybe you're wrong, but that's the decision a lot of people make. That's bad for the market overall because you need people who are healthy paying in order for the whole system to sustain itself financially. Then you'll have people who have to have health insurance because they have some real problem. They're diabetic or they have a chronic illness otherwise. Maybe they have a serious chronic illness like cancer. And they will have to have health insurance. So no matter how expensive it is, they're going to keep paying it even if it really drives them into poverty. And then you'll have people who get sick, who never bought the health insurance, who have to go into hospitals, and those hospitals aren't getting paid by any insurer for the care, and it ends up coming back to the taxpayer. So this really turns into a sort of short-sighted plan for the rest of us, where the public bears the cost of this uninsured population that still ends up needing care.
You mentioned those young invincibles, which are so critical to the insurance system because, as you said, it relies on people who, in some situations, don't statistically have a risk of getting sick, but they have to pay into the system just in case they do to prevent this financial ruin. And then you have those who have these chronic illnesses that need the subsidized care that comes with insurance, because otherwise, who can afford doctor's visits at $5, $6, maybe sometimes $1,000 a pop? It's literally too much. Now, I'm in New York City right now. A lot of people are watching us in New York City. Is there any particular effect that New Yorkers might face, or people in dense urban areas like New York?
Well, there is a very New York specific dimension to this, so I'm glad you asked. Our exchange, the people who buy insurance on that exchange, it's actually pretty small because the state has these other mechanisms to get people insured that are a little bit unusual but have been engineered by health policy experts over the years in New York. However, those other mechanisms are currently getting defunded under the Republican tax cut bill that was just passed this summer. And so our exchange population is going to be 600,000 people, which is 4 times the current size. So there's actually going to soon be a very new, very large population of New Yorkers who all have to go confront that dilemma of individually buying insurance that's too expensive or going without health insurance altogether.
Which after COVID, we see, the public health effects of not having insurance, early prevention, and the economic ripple effects. What about rural areas? Are there any particular specific effects for people who may not be living in an urban center like New York City?
So one of the biggest differences between the rural areas and the urban areas in a place like New York in particular is that in New York City, you have a lot of basically very wealthy hospital systems. And so even if you have some hospitals that face financial distress, you also have some hospitals that really are going to be able to afford these impacts, and they may say otherwise, but they're actually going to be okay and they will stay open, they will continue to treat people. By contrast, in rural communities, there are hospitals that really are teetering on the edge of financial collapse. And so when this money comes out of the healthcare system, they may close. I mean, we could lose around 100,000 healthcare jobs statewide from the federal funding cuts all in that got passed this last summer. We could see tens of hospitals close. It's quite a serious situation in the rural areas.
In the rural areas, hospitals may close. In the urban areas where things are so expensive, people may choose to simply go without health insurance, which is fairly, that's a horrible consequence.
It's really bad. I should also add that we may also see urban hospital closures. Obviously there's a very complex social and racial geography to the city. So you may see parts of the city also really lose access to healthcare. But again, it's not going to be in the same way that it happens in those rural areas where there might only be one hospital, within a 200-mile range.
You've painted a pretty bleak picture of what could happen. What can families do right now, given this information? We're in December. We're at this time period where you're making your insurance selections. What can you do?
Well, I mean, I'm sorry to say there's not really a good alternative. Sadly, the best answer tonight might be political. Call your congressional representative. I mean, there's truly no reason why we shouldn't see every single New York congressional representative supporting a deal to extend those tax credits. You know, we all know the politics of it, but in terms of the interests of New Yorkers, they're very aligned, and people should be very clear-eyed that there is no good case for letting them expire as part of some political deal.
Thank you so much for joining us and explaining this crucial issue right now.